Welcome everyone to the first of 3 videos in my series over the next few weeks or so that I'll be presenting to you. As you can see, it's a beautiful fall day here. The leaves are starting to change color and temperatures are getting a little cooler, but this turned out to be a great day, so I thought I'd spend this time doing the first video out here in the fresh air. I hope it's going to work out okay. So, for those of you who do not know who I am, my name is Richard Robson. I'm the author of The Wiggle in Your Walk Must Go. But more importantly, I've been a practicing chiropractor for 37 years. And over that time, I've been asked innumerable times when I go out to lecture at various groups and companies, and even with my own patients, gee, Doc, why are you still doing this? Why would you publish a book at this stage in your career? Why would you be going out lecturing at this stage in your career? Well, a very simple answer. I think I have a very important message that I've been preaching to people for years and years and years, and I'm going to continue to preach this message for years to come, hopefully. It's a very important message that I think should be shared, and I'm trying to get it out to people, or as many people as I can. So, 85% of the population will either has a back problem or will have a back problem in their lifetime. Of this 85%, the majority of those problems are chronic, meaning that they're there all the time to some degree, oftentimes not very bad, but there, or it's reoccurring. Have an incident, goes away, have another incident, goes away, have another incident. If you're in that type of a category, or you know someone that's in that kind of category, then you really do need to listen what I'm about to tell you over the next couple of videos. It's very, very important. Let me explain a little bit and give you an example of what I see in my office all of the time. I just had one the other day, a young girl. I haven't seen her for a couple of years probably now, since the last time she was in. Last time she came in, lower back sacroiliac problem, adjusted it, didn't want to carry on, got better. I haven't seen her in a while. Just came back the other day, all bent over, could hardly walk down the hall, couldn't get up on my examining table, was just in great distress. Asked her what happened. I don't know what happened, Doc. Gee, I just woke up with it. Okay, you just woke up with it. At that point, I know something else is wrong because you can't possibly just wake up with it. Something had to lead up to it. So I asked the telltale question. How were you prior to this incident happening? I've been okay. I haven't had this kind of problem, nothing like this. And I go, okay, whoa. Tell me exactly what okay means. Tell me what you've been doing. Well, I always get a little bit of stiffness in my lower back since I saw you last, but it's not really causing me any problem. Once I get up and move around, I'm fine. Or my husband and I are doing a lot of walking. She just lost a lot of weight and had been doing a fair bit of walking. I can't walk as far as I used to walk. My legs seem to get a little bit tired. It's that I see as being the big problem. The incident that she came in with really is irrelevant. It's not irrelevant. She's in big pain, so obviously it's relevant. But in the big scheme of things, it's not really relevant. The relevant part is what she's been dealing with prior to the incident occurring. I like to talk about the 3 levels of existence when you have a back problem. The top level, okay, is perfect. And that's my definition of perfect, not yours. It means that everything's working properly, joints are functioning the way they're designed to function, there is no symptom at all, no stiffness, no aching, no reoccurring. It is perfect. The bottom line, the third line, okay, is bad, like the way this girl came into my office, and many others do as well. Hardly able to walk, in dire straits. The middle level is that okay level, pretty good level, okay? That's the level where it may be minor aches or pains, little stiffness or soreness in the morning, long car rides, stuff like that. That's the okay line. Most people gravitate between the okay line and the feeling bad line. Feel bad, get a little bit of treatment or let it rest or give medication or whatever it is. Get to the okay line, that's good enough, all right, until the next incident occurs. So it's a constant bouncing back and forth between the bad and the okay line, all right? Well, it's not okay. That living on that okay line is absolutely the most destructive thing you can do. If joints are not working properly, if joints aren't functioning the way they were designed to function, all sorts of things happen in the body and to the various different joints. Various different muscles start to compensate, the joints start to go crooked, they start to do or move the ways that they shouldn't be moving, and eventually joints start to wear out. Either knees, hips, certainly the spinal discs start to degenerate. It is important that these joints function properly, and without them functioning properly, you will live on that okay line. As I say, the majority of people I know in my practice live between okay and bad. Okay, they get, reoccur, okay. You want to get to the perfect level. You should be gravitating between perfect and maybe it's starting to bother you, and then I'm going to deal with it there and get back to here. All right. So I want to talk a little bit about that okay line and why it's so destructive and why it's so dangerous for you to live in. And it has to do with what the wiggle in your walk. The wiggle in your walk is a condition that's produced by a breakdown in the normal function of two joints called the sacroiliac joints. That's these two joints here. Here's a shot of you. There's a spine of mine. The pelvis here. These two joints way down and low, and these would be right down in your butt, okay, are called the sacroiliac joints. Now, those two sacroiliac joints are moving joints, meaning that as you take a step forward, the sacroiliac joint on that side flips back a little bit. The leg that goes backwards flips the other way, so that as you walk, you're supposed to have a nice normal flip, 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 all right? The purpose of the flip, flip is to raise the hip joint up a little bit so that you can swing the foot through without dragging it on the ground or without having to hitch yourself, in order for that to happen. And the lumbar spine and the spine stays perfectly straight as you're walking, all right? Now, those two joints have a great tendency to lock up or stop functioning. When they do, numbers of things can happen to not only those joints, but structures around it and to the lumbar spine, all right? You start to develop, instead of being able to extend the leg perfectly forward, right, you start to get a tendency of rolling around the hips, okay, on those joints. Or you start to hitch as you're walking. Those are the wiggles in your walk. And those are indications that you have malfunctioning sacroiliac joints and pelvic mechanics in through there, all right? Those pelvic mechanical problems, all right, in themselves will oftentimes produce symptoms. Most often it has to do with sitting. Sitting in a soft, cushiony chair, you go to get out and you kind of have to go, whoa. Go for a long car ride, get out of the car. You kind of have to unwind yourself as you're getting out of the car, all right? Once you get moving around a little bit, everything is fine. But it's that sitting position that'll absolutely drive these sacroiliac joints crazy, okay? So, as I say, as it gets worse and worse and worse and time goes on and you put up with that situation, the extra wear and tear, the extra movement, the abnormal movement in all the other joints starts to cause it to wear out, and you start to get premature arthritic type conditions going on. And it is very, very destructive. Now, just a while ago, I sent out a notification to my patient list and asking them to send me some questions so that I could make sure that I could answer whatever stuff that they wanted to know as I was producing these 3 videos. A lot of patients weren't with me, or a lot of former patients weren't with me when I put out the book. And they say, didn't buy your book, not aware of it, tell me what the wiggle is, no. So in this video, I want to talk a little bit about what is the wiggle and why it's so important, okay? We've talked about how mechanically it's there, all right? But the secondary stuff, the wear and the tear, okay, is what you have to be avoiding, because that degeneration, that wear and tear, will eventually get to the point where correction becomes a real difficult situation, and basically what you're doing is trying to hold your own, okay? So hopefully that answered, when we talked about that, that's what the wiggle in your walk is, okay? One of the other questions I had, and it was very interesting, you seem to always talk about women, and why is it women see this problem more often than men? It occurs in both men and women, but for sure it occurs more often in women. And that has to do with the fact that the female pelvis is a wider structure, all right? I talk about the Q angle, all right? The angle between the femurs and the knees, which is, it's wider in females. So the wider female pelvis is much more susceptible to locking up a little bit. Pregnancy and having kids puts a great amount of stress on those two sacroiliac joints. as they widen in that last trimester and come back in the first trimester afterwards, oftentimes they don't line up, okay? And women start going out after a while, they've had a couple kids, they want to get back into shape, go back to exercise classes, and all of a sudden find out, oh geez, something's not right here, okay? And that oftentimes is a result of those pelvic joints not functioning properly, okay? So it becomes important that you understand whether you have it, okay? So in the next video, okay, what I want to talk about is how you can tell you have it, okay? And I'm going to show you and talk about a number of different ways that you can tell whether you have this wiggle in your walk, all right? And I'm going to show you a couple of tests that you can do at home that will identify whether or not you have this wiggle in your walk. And then later in another video, we're going to get into what you can do to eliminate it, what you can do to keep it from coming back, and a lot of those types of questions that I've been asked so far. So what I'd like you to do for now, okay, is I want you to think about getting ready for the next video. Put your comments in at the bottom of this video. You'll see a place for comments. If you've got any comments on the video, put them in. I'd love to hear from you. We'll try to get back and I'll try to comment on or return your comments or answer all the comments that come in on the page. Tell your friends about this. I really am trying to get this out to as many people as I can. So forward the email that you got regarding this video to your friends so that they can tune in and follow the 3 video series that over the next few weeks. So get on board, and I hope to see you in the next one when we'll start getting down into some real meat and potatoes. Okay? Thank you.